All right, we'll go ahead and get started. Good morning, everyone. My name is Melissa Bullock. I'm the state medical epidemiologist with the Nevada Division of Public and Behavioral Health. And I'm joined in the room today by Cindy here, our state epidemiologist, Kagan Griffin, our office operations manager for the Office of State Epidemiology. And on Teams, we're joined by Kevin Dobson, administrative assistant, and Asia Branch, executive assistant. Welcome and thank you for joining today's public workshop on the proposed amendments to Nevada Administrative Code, Chapter 441A, under LCB file number R174-24. We appreciate your time and participation today. Before we begin, I'd like to review just a few housekeeping items. This meeting is not a question and answer session. Rather, feedback on the proposed amendments will be recorded through public comment. Please mute your microphone unless you're providing public comment. During public comment, please use the raise hand function and you'll be called upon in order. When speaking, please state your name, title, and organization to help us accurately transcribe minutes. This meeting is being conducted in accordance with Nevada's open meeting laws, NRS 241-020, and the meeting is being recorded. For those in person, there are restrooms and a water fountain right outside this door and across from the elevator should you need them. For those in the room, please be sure to use the sign-in sheet to sign in. And those joining by Teams, we ask that you enter your name, title, and organization into the Teams chat now. For those joining by phone, Asia Branch will call on you to unmute and state your name with spelling, title, and organization. Asia, do we have anybody joining by phone today?
Hi, yes.
Okay, I would ask those joining by phone to unmute and state your name and spell your name and title, please.
Hi, the number with the last two digits, 68, you can speak if you can, please. Okay, and how about the person with the last two digits with 96? They just left. We have one more. How about the number with the last two digits, 14? Are you able to state your name, title, and organization?
This is Sherry McPartland, the chief nurse for the Clark County School District.
Is that everyone, Asia?
Thank you so much, Sherry. Yes, Melissa, I have one more with the last digit 68, but I'm not sure if they can hear us.
This is Lydia Sedano with the State Charter School Authority, the Education Programs Professional.
Awesome. Thank you, Lydia. Melissa, that will be all of our callers from that joined in on their mobile device.
Okay, wonderful. Thank you. Copies of the proposed regulations and small business impact statement and the workshop notice are available on the Office of State Epidemiology website at nvosd.org, through the Nevada Legislature's website at leg.state.nv.us, or by contacting our office by phone or email to request a mail copy. We will display these websites and phone numbers here, and we will also add them to the chat for your convenience. A copy of the meeting minutes will also be available through our website. The purpose of today's workshop is to solicit input from the public on the proposed regulations. Following this workshop, the draft regulations will move into the formal hearing and rulemaking process, which includes a review by the State Board of Health. Updates and notices for that process will be posted to the Office of State Epidemiology's website. If you have questions about next steps, you're welcome to reach out by phone or email, which have both been placed in the chat. The proposed regulations and LCB file number R174-24 provide provisions for the following. Establish a process to control tuberculosis in an educational institution. Revise the procedure for screening and screening of tuberculosis of healthcare personnel and in certain facilities. Revise requirements governing the reporting and investigation of coronavirus disease, 2019. Revise the terminology refused to refer to mpox. Establish reporting of wastewater surveillance test results related to infectious pathogens and other biological substances. And establish the ability for public health outreach to persons who have experienced an overdose to provide connection to supportive services, treatment, and other public health interventions. We will now move on to public comment. If written public comment was provided ahead of this meeting, those documents have been noted and will be included in the package that moves forward to the State Board of Health. I will now open the floor for public comment on the proposed regulations LCB file number R174-24. When speaking, please state your name with spelling, title, and organization. We will start with those attending in person and then move to those joining by Teams. Please use the raise hand function and limit your responses to 2 minutes or less. For those only joining by phone, we will ask for comments at the end of the session. Thank you, and the floor is now open in the conference room. We have no public comment in the conference room. We will now move to Teams with Aja Branch facilitating, and she will call on you in the order that your hands were raised.
No hands have been raised, Melissa.
Okay. Just to confirm, nobody joining via Teams has any public comment. Now is your time.
We have our first hand. Jean Freeman, you have the floor.
Good morning. I think there's some concern around the funding to support the tests being done. So I think just maybe if there's any kind of additional clarification about the testing requirements are related to specifically schools once they've done the screening, if there's the testing that needs to be done, if there's going to be support associated with those activities of having that testing be completed. And if there is an expectation of it being a quantiferon test or another type of test. So if there's anything that's specific about that, I didn't see that in the proposal.
Thank you for your comment. Any further public comment? Okay, seeing none in the room or by Teams. Aja, we can move to the phone lines.
Yes, we can.
Any public comment by phone?
Nope, no hands have been raised.
Okay, it appears we have no further comments on LCB file number R174-24 today. Oh, I will pause. I see one more hand raised.
Hi, good morning. Can everybody hear me?
Yes.
Yes.
Yep. My name is Dr. Anil Mangla. I am the Director for Disease Surveillance and Control for the Southern Nevada Health District. Just one comment that I'm commenting on the TB screening. So TB is an airborne disease that spreads through prolonged close contact. And so from a operational point of view, school-related TB investigations currently have a positivity rate of about 12%. Each positive investigation triggers extensive downstream activities, which include contact tracing, medical evaluations, lab testing, case management, and ongoing monitoring. This is a burden to a lot of health departments. It's a burden to businesses, healthcare, as well as school systems. So this regulation establishes a practical evidence-based approach by requiring TB surveillance for individuals with frequent or prolonged contacts with students, aligned with the CDC recommendations. It allows flexibility through either a TB test or a standardized risk assessment and symptom questionnaire reviewed by a licensed medical professional. This is really important, and it's going to save money for schools as well as public health. Each investigation normally allows health departments to investigate almost 500 to 1,000 individuals, and thus screening, being proactive, is going to be an advantage to schools as well as public health departments. Thank you.
Thank you for your comment and feedback. Are there any further public comment?
This is Sherry McPartlin. Can you hear me?
We can.
Yes. Okay. I had to log back off and log back in. Again, just the same sentiments as the other school district had raised as far as just the cost. If there's any cost assistance, that would be available, because the impact in the Clark County School District would be close to about 60,000 individuals. Again, as far as the proposal for the survey itself, just the protection around the questions and, just additional concerns with that. And then moving forward, if this does go into effect, given the size of our school district down here in Clark, could it be something that could be rolled out to disperse the individuals that are already currently employed or volunteering over the course of at least 2 years? That's all.
Thank you for your comment. Any additional public comment?
We have one hand raised. Sylvie Smith, you have the floor.
Oh, thank you very much. Sylvie Smith with Care Services of Nevada in Reno. I'm not sure if it's the floor to ask these questions, but I'm not getting the straight answer for quite some times. Regarding the TB test that the worker need to complete each year, my understanding is that it has to be done every year. Now, there is a different regulation as far as the blood test for TB test. That might be a longer timing for that. Can you clarify regarding the TB test for the workers?
Thank you for your question. Today is public comment only, but we will follow up with you after this meeting, and we'll schedule a one-on-one with you to make sure all your questions get answered.
Okay, yeah, because I had different email and back and forth, and someone was supposed to get back to me and I never got an answer.
Okay, thank you. We'll reach out right after the meeting.
Thank you.
Will there be any additional comments? How about folks over the phone? If you do, please unmute and state your name, title, and organization. And if you haven't done so already, can you please add your name, title, and organization in the chat for us? Thank you so much.
Okay, I'm going to do one last call for public comment. All right, it appears we have no further comments on LCD file number R174-24 today. Thank you for participating in this workshop, and this meeting is now adjourned.